Good morning. Hopefully, third time is the charm. Our guest, we're going to be talking to Dr. Kerry about all things breastfeeding and lactation and hormones and good stuff. She's having some technical difficulties, so let's see if we can. Hello, Alan. I see you there. Let's see if I can find her. Okay. You know it's a good day when you have difficulties connecting on social media. It happens. Let's see what happens today. How's everybody doing? Tell me where you're from, where you're coming from. There we go. I see her. Let's see. I sent her a request. Today. Nope. There we go.
All right.
Hey!
Hello,
Hello!
Julie.
Hello! Look at that beautiful baby you
Hi.
got there.
Yeah, we have
Hi!
let me adjust this hair. We have a fellow girly
Oh
hair.
my
Say
goodness.
hi.
Yay!
Say hello,
Hi!
baby. Hi.
Hi! What a sweetheart. I can't
Say
wait to hear
yes.
what you have to say too.
I I
Yeah.
know. And so yeah, I just learned how to clap my hands,
Yay.
and so it's a thing now.
I love that. Oh my gosh, I love that age. Was she like not
How are
10,
you?
10 months, 11
Not
months? No,
even 8, Julie.
8.
8. She is like 8 going on 18 months.
I know you can see it. That is a bright, sparkly, sunshiny
Oh,
baby, and I love
she
it.
is. She is so much fun and exploring everything in the world like it's not your business.
Yup. Keeping you busy too, right? Well,
Yeah,
let's do a little
awesome.
introduction of ourselves. So, I'm
Yes.
Julie. I'm a speech therapist and IBCLC lactation consultant with LA Lactation. I'm in Los Angeles. This is my Hermosa Beach office where babies and boobies and all things feeding happen.
Yeah.
And tell us a little bit about you and yourself.
Absolutely. Let me just, okay, great. So I'm Dr. Perkins, a board certified OBGYN, and I am all things passionate about women's health and everything having to do with opening up our space so that it's a little bit more, okay, honey, all right.
Well, she has to
So that,
introduce herself too.
you
She's just
sure do.
introducing
I'm
herself.
sorry. I'm sorry. What was I thinking? But yeah, so I really want to kind of like open up spaces where people can talk about things that usually are pretty hush hush. You know, we don't talk about them, we don't discuss them. It's a little bit, taboo to discuss. And so that's my passion and what I do. Other than that, I love being a mama to this little girl. You know, I'm one of those late bloomers when it comes to having children. So, being nearly 40 and having a baby has been a little bit of a different journey, I'm sure. And so I'm excited to talk to you today about all of those kind of things, you
Yeah,
know?
it's so interesting because I had my babies late too. I was
Thank you.
33 and 36 when I had mine. And in Los Angeles, that's the common age. Most of my moms are 80s babies. I
Mhm.
have a couple that are 1970s babies. I'm starting to get more 1990s babies, but it's a lot of 1980s birthdays, which is why I think a lot of people resonate on my social media when they're out here in Los Angeles because they're like, oh, you're making references that I understand.
Yeah, yeah, absolutely. Definitely. I think that, depending on where you are in the United States, those ages are changing drastically, So when you look in like New York, you may have the average, person given having their first birth 39, 40, and then you go somewhere else in the United States, and then the numbers are completely different.
Yeah.
You're now looking at early 20s or mid 20s, and so it's very, very different depending on where you're looking. So that's
Yeah.
beautiful.
Yeah, I'm from Michigan, and most of my
Hmm.
friends got married right out of college at like 22,
Hmm.
23. They started having
Uh-huh.
babies in their early to mid 20s, and I was the old maid, right? I didn't get
Hmm.
married until I was 31 or 32. And so
Hmm.
it was a very different. Going back home, all of my friends have like middle schoolers and high schoolers now. But out here, I have a 8 and 5 year old in second and kindergarten, third and kindergarten now, and
Hmm.
most of my mom friends are in their 40s.
Hmm.
There's some in their 30s, some in their 40s, a couple in their 50s with like elementary school children. So I do feel it depends on where you live, but that demographic can definitely shift.
Oh yeah, absolutely. It really truly
Yep.
does. Um, and it's I think a little bit of that is just a reflection of what priorities are, and it just brings up different concerns when it comes to the labor process, delivery, getting pregnant, fertility, and of course from the postpartum side as well, can just bring up a different set of challenges depending on where you're from.
Where, what do you feel those biggest challenges are from the OB perspective?
From the OB, I'm going to say first is fertility. So if we look at the chances of spontaneously getting pregnant um, on the East Coast is a lot more difficult. And so what you find is that you have more assisted pregnancies through ERT or through, reproductive health. And as far as, other challenges may apply to those who are younger. When you have those who are older, we find that they don't necessarily have the financial strains that someone who is younger prior to their career being, established. They might not have the same difficulties. So, if you're a little bit older, you have different challenges, and younger, it just looks a little different.
Yeah, for sure. What do you feel
Hmm.
is the biggest difficulty for women specifically in their 30s and 40s? What are their biggest concerns with pregnancy and birth these days?
I would say that, 30s is actually, if you ask me, a really, really great time to get pregnant. And so I think what happens in the 30s, though, is that most people are thinking in their minds that I need to hurry and get pregnant. I need to get pregnant. I need to have my children. They're getting a lot of pressure from their families asking, mom's like, when are you having a baby? And so
Yeah.
they're thinking about relationships. They're thinking about which, direction to go and when would be the right time. And so they kind of, I think, struggle a little bit more from that end,
Mhm.
even though they're in a really prime time when you think of the ovaries, this is a beautiful time to have your children. But the pressures being that, once you're 30 and 35, it's like now you're going to be geriatric, in pregnancy. Now you're just so much older, and it's
Yeah.
like, oh, I don't want to be that person. But I tell my patients and followers and friends all the time that listen, we're fertile. You're fertile for a while. The best thing that you can do for yourself is being aware of what your fertility status is like. Because yes, there are some of us where by your mid 30s you may be depleted of eggs, and there are others that you could be 50 and your ovaries are still out there working and pumping and working in your fertility favor, so it depends.
Yeah, yeah, for sure. The biggest thing that I'm seeing is people going from having their babies in their 30s,
Mhm.
having young elementary school kids in their 40s, and then going through perimenopause, where they're like, I
Mhm.
was not expecting this. I thought I would have more time in life. Are you seeing any
Yeah.
shifts too in the modern day with perimenopause coming on earlier, or are you still seeing that kind of all over the board?
You know what? It's very, very hard to tell, and I'll tell you why. I think that the we're now starting to have more discussions about perimenopause, and so as I mentioned earlier, a lot of people are not necessarily we're not, or a lot of females weren't necessarily having these conversations and talking about the things that they're experiencing. And so between social media and the fact that we are talking so much more now and communicating so much more, I think that's becoming more out in the open that this zone and these transitions exist and that we can do something about them. So do I necessarily think that there's more of that or is happening earlier? Not necessarily, but I do feel like it's becoming more, we're more aware of it, I would say. But on another note, I would say that we do know that we our hormonal presence is changing and it's being affected by the things that we're eating, our lifestyle, all of these, factors, that are present that affects us. And so what's happening with those is that it does affect how our eggs function and our ovaries function. And so I think with more research, we can probably more affirmatively support the fact that our lifestyle may be causing perimenopause to start earlier or menopause to start earlier. And we do see that on the side of puberty, where puberty is starting so much earlier in young girls. So before, where we're looking at 11, 12, 13 would be the age of puberty. Now we're seeing this at like 9. And, so when you think about the fact that we're still born with the same amount of eggs, and if we're starting to release them earlier, essentially menopause should be happening a little bit earlier as well.
Wow. Yeah, that's crazy. I'm not ready. I have an 8-year-old. They're like, no, that can't be next year. No.
I can't even imagine. Okay. I don't know if I'm ready for those conversations yet.
And they start earlier than you think. Oh my gosh, children.
Yeah. So, your daughter might be like right on the brim.
Yeah. It's interesting to me because from the lactation perspective, right, it all is important. Puberty is when breast tissue starts to develop. Hormones during puberty are what lay down the foundations, not only for the reproductive side from what you're talking about, but also the reproductive side of what I do, of bringing in early breast buds and then breast development. And periods are such an important part of developing breast milk making tissue through that puberty, early womanhood, to then be able to successfully lactate on the back end, right? So when you have hormones that are already being impacted at 8, 9, 10, 11 years old, when you look at the bigger picture, it has a lasting effect on fertility, which is your side, and then on the lactation, which is my side.
Absolutely. And so it kind of shows you that everything goes full circle, and so everything from, the child starting on the inside, growing in the womb, all the way through her going through her reproductive years, it all ties together.
From your perspective, how do we then support that life cycle? What are your best tips, tricks, advice on balancing the hormone perspective through the lifespan?
Yeah, I think the first thing that we ought to do is probably improve our education in schools. I would say that our sex ed classes, if they're still happening, are probably not really focusing on the things that are most critical when it comes to females and males as well, even though I don't focus on the male side, but doesn't necessarily focus on the important things and the practical things the way it ought to. So I find that there's a lot of lack of education in our modern times, but as well as our baby bloomers. There's a lot of lack of education and information and knowledge. But if we were to even look beyond that, would say that if the parents are well, knowledge on this information, then they'll be able to pass it on to their children at an earlier age. And then when they go to school, then it's just supporting that, so that when they become adults and they're living, they're able to apply all the things that are important to helping to keep our hormones balanced, to keeping our bodies healthy. And so it could be from the basics for how to eat well, how to move, how to supplement when necessary, how to follow up to make sure things are in their right levels and appropriately okay, to all the things that as an adult, if you have conditions and how those might impact how your body functions. I mean, there are so many levels, but I would say education, I would say, would be the key. And it should start in the home and in those earliest classes that we're having in schools, educating about our bodies and reproductive health.
Absolutely. Which honestly, I've started to see a shift in that because of, thank God for social media, right?
Yeah.
And discussions like this, where healthcare professionals can do a live, and people, all these lovely people, humans out there that are watching us today, that are starting to learn that information that was either not known or taboo in the past, right? And so that is, I'm thrilled to have a social media platform like this where we can actually talk about it, get more education out there and awareness, and then continue to support that. Because I know in my generation, I'm an 80s baby, all of this stuff was just not talked about. And even what you're talking about sex education, it was very vanilla and very basic, right? And we didn't actually really talk about the human body and functions of the body and importance of diet and how it all connected together. It was almost like things were separated. It's like, here's your anatomy, and then here's a little bit of physiology,
Right.
but it was never like, let's bridge anatomy and physiology and then why it matters. Why is that important, right?
Right.
And that's what I'm hoping we can do with social media.
Also, yeah, that's also like a little bit of a reflection of how I think our educational systems are set up in general.
Yeah.
You know, it's like if you think, even as a physician myself, right? So we learn biology and the physics and the chemistry, and we learn all of these things independently, but we don't learn how to practice as a physician, how to really put these things together. You know, we call them, you want to get hands-on training, right? So you learn things separately, and then you need to find a way to apply them to your work, to what it is that you do and how you do it. And so it creates a challenge when it comes to education in the sense of anatomy and phys, for instance, because you know that there's something down there, you know, we know that there are organs and there are things inside, but do we practically know how they work, or their importance, or how or lifestyle may impact any of those things? You know, we don't really know.
Yeah. I find myself doing a lot of that education one-on-one and on social media, right? About how things work. And for me, I was always the one in school that, like, don't give me busy work. I don't want to do, homework. I want to learn why.
Yes.
Why is it important? Yeah. Like, I'll do anything you tell me to do if I understand why you're asking me to do it. And I know in our worlds, the birthing the baby, the feeding the baby, right? It makes a difference of why, right? Like, let's just take, for example, hormones for making milk, estrogen, progesterone, prolactin, all of these hormones, right? They're driven by things that you did during puberty. So I'll have moms that come in to me and they're like, I'm not making enough milk. And when we go digging, we're like, oh, you were on birth control for 15 years and you never had a period. Your periods were suppressed and your breast tissue didn't develop during puberty. That's why. That's why you're struggling now. You have insufficient glandular tissue because way back there, the development was disrupted. And being able to tell people the importance of what they're putting in their bodies, right? I had patients where there was anorexia, bulimia in their history, which again impacted periods, which impacts breast development. And being able to then discuss why things are now happening, why we're seeing symptoms now, can then be like, oh, and then the light bulb goes off.
You know, and it's crazy that you mentioned these things, because I think that a majority of the world don't really know this. You know, they don't know that you can stunt or change or alter your normal bodily functions by just using some of these medications or different things that you may be exposed to in your teenage years. I feel like those teenage years are such an important time for your body to find itself. You know, it's, you're learning about the world, but your body is learning as well how to function. And so, yeah, we can definitely impact all of that. And it's, on the back end, when we learn of this and we're now in our 20s, 30s, 40s, we're just like, okay, what do we do now? What can we do when we're having those kind of challenges? When we've already, like, what our history's done or our past is over, what do we do?
Yeah. And sometimes we can make changes, right? We can make lifestyle changes. We could do diet or supplemental changes. Sometimes just understanding why can bring closure,
Mhm.
right? Of why is this not working? I'm triple feeding. I'm pumping all the time. I'm feeding the baby. I'm taking all the supplements. I'm eating everything. Why am I still not seeing milk when everyone is telling me, well, just move more milk? And sometimes being told, oh, when we actually look back at your history, these are all the reasons why. Sometimes that can then help bring closure and shift the focus into whatever's actually in front of us, to
Yeah,
then be able to support that parent in whatever journey they're on, whatever's going on.
yeah, yeah. It wasn't until I had a baby and I was having a really hard time with breastfeeding. Those first three to 4 weeks were tough. I was like, you know what? If my motivation, honestly, outside of the fact that I wanted her to get as much protection and benefits from, this liquid gold as possible, my motivation was really military. And so I was just like, you know what? I'm up for deployment. And it's just like, I don't want to leave this little one at this moment. But if I breastfeed, it will hold off that deployment a little bit. And so I
Wow.
was like, I really, 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 truly want to get past this pain, and figure it out. But it was my lactation specialist that kind of got me through. And that's when I really, like, I always super supported lactation specialists before, prior to that.
Yeah.
But then I really became in love with them once they got me through the hump and just really kind of changed my perspective on what's really happening in the booby that's affecting this flow, and really learning the small intricacies of how to improve milk supply, and some of the things that could be happening with babies, like she had a tongue and a lip tie that,
Yeah.
I didn't realize how much that really impacts you, because as an OBGYN, listen, I'll tell you everything about your pregnancy. We'll get you through that
Yeah.
safely. We'll have a beautiful delivery. But that period where the baby's present is really just short-lived for us. It's a very, very, it could be from a few minutes
Yeah.
to maybe not even an hour, right? But the life after birth is really so different that I appreciate the presence of a lactation specialist, because I think it makes the biggest of a
Well,
difference.
and honestly, your job impacts my job, right? We know that your what you do is very important to set up what will happen when you see me, right? We
Absolutely.
know that interventions during birth are one of the number one factors for why milk supply can be delayed in transitioning or coming in, right? If I have a mom that had a 36-hour induction with 4 hours of pushing who ended up in a C-section and had 6 bags of IV fluids pumped to her, and I see her on day 5, I'm like, girlfriend, I'll see you in 2 weeks when your milk finally transitions. Like, there's so many things that happen in that 24 to 48-hour period that then impact lactation for the same reason we're talking about, right? Hormones,
Yeah, yeah.
fluids, medications, trauma, all of that really impacts feeding. And birth is such an important piece. People don't realize the impact of birth on feeding.
Mm-hmm. Absolutely. And I don't think we understand that well enough, from the professional side. And, when often speak to patients, and we're talking about, whether we'll have an induction, or do we want to wait for your body to naturally go through the labor process and all of these things. These are things that I'll bring up and I will discuss just the same, because we can, artificially come in, and for some, the various reasons we may need to, for medical reasons. But for those who don't, I really highly encourage just letting your body go through the process and the journey, because an induction can really be a 4 or 5 day process that includes use a lot of medications and interventions, and it can be a while. Or we can, go through labor, and then when your body naturally goes through this, you realize that the time that you actually may need in the hospital setting may not be as grand, it's just much better. But, there's so many different stories and so many different reasons, we try to embrace them all. But if there are ways that we can limit the interventions, I support that highly,
It's interesting because I worked in a hospital for 13 years, worked on postpartum in the NICU, and had my babies out of hospital with midwives because of a lot of the things that I was seeing in the hospital. My own hospital, I think, had a 40% C-section rate,
Oh
really,
wow.
really high. The Los Angeles has
Yeah.
a pretty high C-section rate, right? And when I
Yeah.
started my practice, I started working with midwives and birth centers, teaching prenatal breastfeeding classes for women expecting to birth in a birth center or at home with a midwife. And with midwives, they don't do the breastfeeding education, right? In a hospital, you'll get whatever the hospital has, but in a birth center, I was the one then teaching. And I can tell you, I see a big difference in how breastfeeding goes for those who are birthing um, out of hospital, at home, in a birth center, and or in the hospital unmedicated compared
Mhm.
to medicalizations. Now, it doesn't happen with everybody, right? It's as wide a variety as humans are wide in variety, as wide as the color as there are colors, right? There's so many different colors and variations of birth stories. But I
Mhm.
definitely see feeding going very different from people who are not having a lot of interventions compared to those who are having interventions.
Yeah. Yeah. So being that you've been on both sides, what would you
Yeah.
say is your recommendation? So, you know,
Yeah.
prime
It's such an
person.
interesting thing, right? Because it's so
Yeah.
personal,
Yeah.
right? For me, when I was a teenager looking for a career, lactation wasn't what it is today. So I became a speech therapist to feed babies in the NICU. But I looked into being a midwife and I was like, I don't want to birth the baby, I want to feed the baby, right? But I had gone down that rabbit hole of all things birth and feeding and I had always known based on my own research that I wanted unmedicated, um, out of hospital. I loved hospitals. I wanted to work in a hospital. That was my career goal. But I also always knew I wanted to birth out of hospital. And I've seen a lot of my friends go in both directions. And it really comes down to what does that person need and what do they believe about birth? Some people, my
Mhm.
husband was like, we're going to birth where? Like when I told him we were birthing with midwives and not in the hospital, he was so confused because he was like, he's in film and TV. He had only ever
Okay.
seen film, like TV movie versions of birth. And he
Mhm.
knew I worked at a hospital. And he's like, this doesn't make sense. You work at a hospital, you work on postpartum. Why would you not deliver where you work? And I was like, oh, no, you don't get it. And then as soon as he saw our out of hospital birth, he's like, oh, that was amazing. Why don't
Oh,
more people know about this? Why don't more
yeah.
people do this?
Yeah.
So,
Yeah. No, there's a lot of fears when it comes to the medical community, and concerns. And, I like to think of it more so on the benefits of certain
yeah.
things. Not so much because this is bad or this is dangerous. It's different and has different purposes, right? I'm one of those that I super love midwives, doulas, lactation specialists, all these supportive, you know, professionals that can help with the journey, to bring your baby healthily here, and for them to thrive as well. And I think that there's a place for all of that, but I think that in general in medicine we're definitely fear driven in a
Yeah.
lot of ways. We're fearing of not necessarily things that are happening naturally in our bodies, but more so we're fearing things like litigations,
Yeah.
and these things may impact, the way things look because we just have fears of so many different things. But I think the conversation that really matters is that we want to be sure that we are in a safe place and with
Yes.
providers who can safely assist you. Like a home birth is not necessarily perfect for
Yes.
everyone in every scenario. So we want to be healthy and safe so that, neither your baby nor yourself is at great risk. But if you're low risk, I support it
Yeah.
100%. I'm even considering the same for my next, like maybe we'll do a home birth instead,
Yeah.
Well,
I think you're right. It's whatever that person needs to feel supported. And again, to cycle back to social media, to be able to see that it doesn't have to be the film version of screaming, terrifying birth. It can be for
yeah.
some, right? But to actually watch other women birth, because we're not in a tribal community anymore, right? We don't watch our sister or our cousin or aunt give birth like we used to in more tribal
Mhm,
communities. And
mhm.
I think being able to hear stories that it can be safe, it can be comfortable, it can be supported, it doesn't have to be this terrifying thing, can then also shift that mindset, right?
Correct.
And then finding hospital staff that are supportive, that don't, because I worked in a hospital, it tends to get very routinized, right? Of like, this is what we do, this is protocol,
Mhm,
everybody gets an epidural, everybody gets,
mhm,
everybody. And you're like, no, it doesn't have to be the same for everybody.
mhm.
It can look different for different people and still feel supported. And as you said, still be safe.
Right, exactly. Um, I think that's all a little important. It's kind of crazy seeing her and having her be so moved, like moving everywhere. Like she's so. It's such a beautiful thing watching her develop and change. And now it's just like, okay, I want to touch everything. I want to be everywhere. And she's starting to tease too, so she's over here like, you know,
uh,
on
yep.
her fingers, and everything around her is 100% food or
Yeah.
available for the mouth, for tasting. Hi, baby.
I love that.
That's cool. So what are some of like the misconceptions, Julie, that you think exist surrounding breastfeeding?
That it's natural and that it's just going to happen, right? That's the number one. It's like anything else. You've never done it before. That baby's never done it before. And lack of education can really set people up for failure, because it is a very complex process when you think about everything that has to go into two bodies. It's a relationship. There's
Oh
two
yeah.
patients that I'm working with. We have the mother side, and again, birth history and medical history play a role in her body and what her body is going to do. And then we have a baby,
Oh
and
yeah.
that baby's birth to the baby and their anatomy and physiology also impact feeding. And so that education that, hey, you went into a 48-hour induction with 3 hours of pushing, you ended up in an emergency C-section, you had a lot of interventions, that's going to delay some things with lactation. We're going to need to do some interventions to support you. And oh my gosh, your baby has a tongue tie and is
Mhm,
ripping your nipples up. And we need to do interventions to the baby as well, to then get
mhm,
things going off. So when people have this mindset that I don't need to learn about breastfeeding, we'll do that on the back end. It's like, oh, you have no idea what you're in
mhm,
for, right?
mhm.
And
Yeah.
so it's natural, but it definitely needs nurtured. And it's a lot. So when you can get the prenatal education, when you can see others breastfeeding, when you understand how it works, it can
Mhm.
then really help whatever goals that family has.
Yeah, so you would recommend that the OBGYNs start that conversation with the breastfeeding from prior to labor
Yes.
onset.
And
Um,
And even encouraging the hospital lactation classes are great. They've shifted
mhm.
since COVID, right? They used to be in person. Now, a lot of hospitals have gone to videos. They may still be in person, they're just different, right?
Yeah.
But encouraging OBs to send to a private practice lactation consultant to meet ahead of time so that you can do more one-on-one individual courses on whatever your questions and goals are. And then that carryover of care after the
Yeah.
baby's born can be really helpful because we can then get to you sooner if there are issues. I've had a lot of moms that were like, yeah, no, I did an hour class at the hospital on breastfeeding. I thought the nurse would teach me in the hospital. They don't have time, girlfriend. And then 3 weeks later, they're finally getting to me because they're like, I'm not seeing milk. I have low milk supply. The baby's fussy. My nipples are ripped up. And if we could have gotten to you on day like 2, 3, 4,
Yeah.
it'd be a very different journey than getting you 3 weeks in.
Yeah. Do you think that lactation specialists in the hospital, do you think that they are burdened by the loads as well? And do you think that might impact how the time that they get to spend with each family, and each unit?
Every hospital system is its own universe. I have found that most hospital systems are overburdened for their lactation consultants. We're not always seen as important in the piece of the pie. So at my own hospital, we were very overrun with patients. I would have days where I'd have 12 to 16 families to see in an 8-hour shift. So you can do the math of how much time I would have with each family. So a lot of hospitals that have appropriate lactation care, those patients can then get the care that they need. But in my experience, so many hospitals have not enough lactation staff and don't have enough time, or you might not be their priority, or they might be pulling nurses to do lactation when the nurses don't want to do lactation. And that in Los Angeles, anyway, I see families from many different hospitals. I know the hospitals where you're going to get good lactation care. And I know the hospitals where I'm like, ooh, you're not going to be seen until discharge. And they're going to be like, here's some formula, bye.
Yeah, yeah. And unfortunately, that's, what I see on my end as well, where, it's sometimes you're just in the right place at the right time, and then you're getting the right support, and that's not necessarily the same across the board, unfortunately. But what would you say for someone who may not get that care? Because, for instance, sometimes the lactation specialists are not available on the weekends, and say, it's a Friday. And now it's like you have a baby at 11 p.m. on a Friday night, and you're probably getting discharged by, Sunday, and you don't see a specialist. What would you recommend for those patients? Like, what can they do to help to overcome not necessarily getting that support?
Yeah, it's like prenatal education. If they already have an established relationship with a private practice lactation consultant, they can then email, text, message, and say, hey, I had my baby Friday. Can I see you Monday? What should I be doing? When I see my prenatals and they birth on the weekends, you better believe I'm like, okay, start hand expressing, keep baby skin to skin, get them out of the swaddle, get them out of the isolette, get them on your body, start hand expressing. I teach every prenatal patient how to hand express so that they already know I have milk starting at 14 weeks gestation. I already have what my baby needs at birth, but interventions can get in the way. So I'm already prepared mentally of what to expect and a plan for hand expressing, pumping, keeping baby skin to skin, getting the baby fed, getting the milk supply in, so that we're then not sabotaging the journey. And I think you're absolutely right. Education is where it really starts.
Okay, so tell me a little bit more about this hand expression, because I don't even think I know how to hand express at this time. But so when would you recommend that you start that?
So I recommend the prenatal courses sometime between 34 to 38 weeks. I teach hand expression, and a lot of people can start seeing colostrum. It's there, it's already there, but can start seeing it around 34 weeks. I recommend antenatal hand expression starting at 37 weeks. And depending on the situation, actually collecting that colostrum to bring it to the hospital, obviously discussing with the OB, the midwife, for safety of that. We talk about low risk pregnancies. If you're not on pelvic floor rest, then it would be considered safe to start hand expressing. And honestly, my discussion is, if hand expression or pumping alone were enough to induce labor, why is every OB not recommending that over a medicated injection? Yeah, right. So hand expression is basically using your own hands to be able to express and move your milk. And I teach those techniques in my classes. I have separate videos on that. But colostrum is a thick, sticky, syrupy first milk that a pump has a much harder time moving. So I like to tell patients it's like drinking a very thick milkshake through a coffee stir. So hands are much better at moving that. So I'm teaching patients to discuss with their healthcare providers, but starting at 37 weeks, they could start harvesting and storing that in case supplementation is needed after birth.
Yeah, what I often refer to as nipple stimulation. Um, it's essentially equal to the hand expression, but it's such a beautiful way to help the natural onset of labor. Between that and of course sexual activity and all of that. And I tell my patients, I'm like, listen, once we hit 37 weeks and you are now full term in your pregnancy, oh, we're opening up and we're using all of these, remedies, if you will, to help you bring on labor so that we're not necessarily 41 weeks pregnant and we're just like, listen, my cervix is long and closed and nothing is happening. We want to help to encourage that from day one. And so at 37 weeks, this is where it's just like, yes, we're doing all of these things and I recommend them so that we don't necessarily have to get the medicated inductions,
Yeah.
I love that.
Well, and honestly, I can't tell you how exciting it is in a prenatal breastfeeding class to see milk, because so many people don't even know that they have milk. They still think milk has to come in. Milk doesn't come in. It's already been there for whenever baby's born. So it's so exciting to me. I get so excited when I'm like, you want to see your milk? And they're like, but I'm 36 weeks pregnant. I'm like, I know, I'm so excited. And then we go in and they see that milk and they're like, I get so many like, I'm so excited. And then they like, I want to go tell my husband. I want to show my partner. They get really excited to actually be able to see, oh my gosh, my body's already making milk. And it kind of gets them ready for that process to be like, I've got this, you can do this. And even if they don't harvest, to be able to see and have that confidence that I have the milk my baby needs, I don't have to wait for it to come in, educating on why it's a thick, sticky liquid, educating on why it's a high protein laxative to help baby poop. It's a small volume and thick to help baby practice swallowing. Gives parents that confidence in those first 3 days that my body grew this baby, my body can feed this baby.
Oh yeah, it's the cutest thing also seeing them as soon as they're born. I'm just like, these babies, they are ready to find the boob and somehow it's innately within them. They can smell it, they already know it exists, and within a few minutes they can just make their way to your nipple and start the process on their own. And like you said, yes, your body already has done the work and it's already prepared. Like it knows exactly what to do. And everything that baby needs from the very second that this baby exits your body is already there and you already have it. And so I love that. Absolutely. Yes, baby.
So when are you moving to Los Angeles so you can come work at the hospital? And I can
Julie,
open our own center. Let's do it. Birth them and feed them.
listen, we would have to pass, encouraging my husband to leave Pennsylvania, which he's not a fan of. I can tell you that, it's no, no, no. Yeah, Julie, I have a question for you.
Yeah.
A girlfriend of mine had a 23-weeker recently.
Wow.
And if you can imagine at 23 weeks, there are so many different challenges with that. And so for her, while baby is now in the NICU, and baby is now approximately 30, about to be 31 weeks. So the challenge she's having now is that there isn't a baby present to nurse and to help to establish her milk supply and to encourage her milk supply. And now she's right around that 6-7 week mark. And overnight she's been going crazy because she was pumping and getting probably a total of like about 3 to 4 ounces. And now it's half. And so now she's getting about 2 ounces. What would you recommend in a scenario like that? What can she do to help her milk flow?
Number one, make sure she has a quality pump. Not all pumps are created equal. There are really good pumps out there and there are really bad pumps out there. So having a pump like the Unimom Opera, the Spectra S1 or S2, sometimes the Spectra Synergy Gold, not the portable one, but the actual gold, a Medela Symphony, depending on the mom, a Limerick Joy, really good quality pump is essential. Number two is the right size pump flange. The majority of people cannot pump with what comes in the box. I can literally count on my hands the number of people that I've put in what comes in the box. The vast majority need a different size or a different material. And then frequency of moving milk. And that's really the hard one when you're not with the baby. The body wants to feed its babies and it makes milk based on how milk is being moved. So the more milk that's moved, the more milk is made. And when too long of time passes between pumping, we then can see supply drop to protect the breast. The breast doesn't want milk sitting there that's not being moved because that makes us prone to infection or plugs or mastitis. And then pumping at the NICU as much as possible with the physical baby there. Doing skin to skin first and then pumping shows us in the research that those moms can pump anywhere from 20 to 30% more milk just from being with the baby or near the baby when pumping. And then the biggest encouragement is once that baby hits 33, 34, 35 weeks, nuzzling at the breast and having that experience can really help continue to increase that supply. So number one, good quality pump. Number two, correct size pump flanges. Number three, enough milk removals. And number four, good hydration and nutrition, focusing on quality proteins. And really, it's what we should all be eating: fruits, vegetables, meats, grains, avoiding processed foods, avoiding lots of sugar and caffeine, and really just eating how we all should be eating to support our hormones. There's no magic bar or tea or cookie that's going to help bring in that milk over those other things that I listed.
Yeah, absolutely. I love that. I see that someone was asking, what are those pumps again? So if you can repeat those, and then we have a follow-up for that as well.
So the Unimom Opera Plus is a great primary pump. The Spectra pump, Spectra S1 or S2, their only difference is one is battery operated and one you have to keep plugged in, or the Spectra Synergy Gold. The Medela Symphony is considered a hospital pump. The hospital grade is a marketing term, but those are the big, it's like a $1,500 pump that you would rent from the hospital or a lactation consultant. The Limerick Joy it's a tricky one because it is a one size fits all flange. A lot of people really like it, respond well to it. But that again, there is no one size fits all pump for everybody because there's too much variability in our anatomy and how our bodies work. But those ones are the top of my list. Portable pumps, the little ones, the size or smaller, the wearables that sit inside the bra are not good pumps for NICU moms for exclusive pumping. They are great to supplement, meaning you're using a primary pump 5, 6, 7 times a day and you're just sneaking in extra pumps to get milk moving. But I will never recommend an LV, a Willow, a Mom Cozy, a Baby Buddha to be able to move milk as a primary pump all the time. Pumpables Genie Advanced is the one that can do a decent job for a lot of people, but still most people in a NICU situation really need a good primary pump.
Oh, I love that. Thank you. I think that one for someone like myself, where we're nursing, my child was like the first 24 hours, I think she didn't want to leave the boob at all. And so by 48 hours, like the milk letting was intense. It was just it was a lot. And so didn't really have an issue. And she's really nursed every hour and a half to 2 hours since. But for someone who's exclusively pumping, I feel like, yes, pumping is like that mechanical pull of trying to get the milk out it can be a lot on the breast in general. So Are there any things that you would say that you would recommend to help maintain the the natural nature and comfortability of your breast and your nipples in that
Yeah,
scenario?
keep the suction low. Don't suck your brains out your nipples. More is not better. Lubricating the flange can help. Finding the right size flange is essential because I have found a lot of people were like, I was in pain. I didn't realize how painful the wrong size was until I actually got in the right size. And then
Yeah, that was
lubricating that
me.
flange, yeah. Lubricating that flange with some coconut oil can help. And there are some people who actually do better with either a hand pump or hand expression. So if you're struggling to find the right pump flange, if you're finding pumping is painful, having control with a hand pump or hand expression can work just as well and sometimes be either more efficient or more comfortable. It is a learned skill that a lactation consultant can help teach, but don't underestimate the power of this pump.
Yeah, yeah. Now, how often would you say that in that scenario that she should pump? You know,
The
that,
lactation consultants will vary on this, but you'll hear anywhere from 8 to 11 a day, which would be what a breastfeeding baby would do. Some people can get away with fewer, but in general, you're looking to feed the baby, which is your electric baby, anytime your human baby is eating, which is usually about every 2 to 3 hours during the day, every 3 hours overnight, with possibly 1 4 hour sleep stretch, depending on the situation. But you really need to be moving milk around that clock routinely until you've established a milk supply. And then once you've established a milk supply, we all have a different storage capacity, which is how much the breast can hold at any given time before seeing milk drop. So some people can go longer between pumping or feeding once they have an established milk supply. But the body is very much driven by biology. The more you move, the more you make. And so it really is critical to be telling the body to be ordering that milk from the body routinely.
yeah, yeah. And I so love everything that you just said. But I think it's usually it's the difficulty there is of course sleep. You know, it's just like, but when do I sleep? You know, there's nothing greater than being able to get a nice stretch of sleep and rest, which I have not seen in almost a year.
Yeah.
But so, you know, I feel like when the baby's not present, it can make that a little bit
Yeah.
difficult too.
What I'll always tell my patients is for the first 3 months, you're in
Mhm.
Vegas. You're in Vegas. You eat when you're hungry, you sleep when you're tired, and social conventions and norms go out the window, right? If you want to eat breakfast at 10 p.m., eat breakfast at 10 p.m. If you want to have your longest sleep stretch at 8 a.m., that's what you do. I think the issue with the United States specifically is we have really bad maternal mental health, really bad maternal and postpartum care. A lot of women are going back to the workforce while still in diapers. They're not getting extended maternity leaves. They have unrealistic expectations of what they should and could be doing. And
Mhm.
we're pushing moms. I see it in Los Angeles all the time. Moms that want to go have lunch dates at 4 weeks postpartum while they're still in diapers, right? It really should be, theoretically, again, my bias, we should be having moms have the realistic expectation that you have a very young infant that is completely dependent on you. And social norms need to go out the window. It's you eat when you're hungry, you drink when you're thirsty, you sleep when you're tired. And it sounds tongue in cheek, but it's sleep when the baby sleeps. But we're not supporting that as a society because there's a pressure to get to bounce back, to get back to the gym, to get
Yeah,
back to
yeah,
work, to go. They see maternity leave as a vacation, which it's not.
right,
Maternity
right.
leave is not a vacation. You're not going to go to brunch. Okay, you're living in 1 to 2 hour windows.
Mhm.
And I think if we can shift the mindset, it can then help people be able to find that rest and find the sleep and the nutrition and hydration and support that they need.
Yeah, I agree with you 100%.
Now,
Or
I need to wrap it up because I have a 9 a.m., but I would
mhm,
love to
mhm.
hop on another call with you again
Yeah,
sometime.
yeah,
This
yeah,
has been
yeah.
great.
Absolutely. Thank you so much for just being so informative and giving us so much information on this topic. And you know, there's I feel like there's so much more that we could talk about. It's been such a pleasure, Julie. And yeah, it would be great if we probably should have like a part two, and just talk and dive a little bit deeper into this.
I would love that. Let's do
Yeah,
one every month. Everybody can join us for our monthly live.
love that. Love that. Yes. Thank you so much, Julie. And we'll keep in touch.
Was great. All right. I'm so thankful that you reached out to me, and let's definitely do this again soon. To everybody out there, don't forget to like and follow both of us and keep your eyes open for our next Instagram Live.
Yes, sounds good. Thank
All right.
you.
Thank you.
All
Bye.
right.